IT team with her presentation, please.
Thank you very much. Good morning, everyone. So my name is Kanyi, representing Minet Kenya Insurance Brokers. I'm here to take you through the teachers' medical scheme cover so that you get to understand how the cover works, what are the benefits, and how you can be able to access to have a partnership with the other third party services that they can't offer themselves, and also they are not everywhere. And as we know, is that the teacher medical scheme is across the country because we are we need all the teachers in the whole country to access cover. So Bliss, one of the very important role for Bliss Health is to ensure that they are with other service providers, other hospitals, to be able to give the benefits. The Medical Administrators Kenya Limited, their role is to accredit the third-party providers, other hospitals. So it is MAKL that contracts all these other hospitals that give teachers the medical services. They are also responsible to ensure that they identify and they verify the teachers when they go to the hospitals. That is to ensure that only the eligible teachers are accessing the services. They are also responsible to ensure that they manage the pre-authorization. Not all services that are pre-authorized in the scheme, but there are those services like inpatient cover where you're told this must be pre-authorized, mainly is to manage the benefits of the medical scheme. They're also responsible to manage the referral system. That is where a teacher or a member needs to access a service from a hospital. Probably you had gone to the hospital to access cover to a primary health care, but the services that that teacher or that member needed to access are not available there, that they need to refer. So it is MAKL's role to ensure that this referral system, this referral process runs smoothly. They are also responsible to ensure that the claims have been processed and the service providers have been paid. I had mentioned other insurance companies, that is Old Mutual, CIC, Britam, and Star Discover. These insurance companies, they manage a benefit that is fully insured. And this benefit is called excess over benefit. Whenever you go to a hospital, especially for inpatient services, sometimes your cover has limits. It's not. It has benefits. It depends on the job groups. So that's the responsibility of Old Mutual, CIC, Britam, and Star Discover. They ensure that these benefits are paid and the payments are also paid. Pioneer Assurance and Star Discover, their role is to provide the last expense benefit. This is in the unlikely event of a demise of a principal member. So that's it as far as the consortium members, their roles and what they do for this medical scheme. So we'll go very quickly on the benefit structure. So the benefit structure for teachers medical scheme, there is inpatient benefit, there is outpatient, there is dental, there is optical, there is maternity, there is the funeral cover that we call last expense. We have an evacuation benefit and there is an international benefit. So for inpatient and outpatient, the benefits or the limits depends on the job group of a teacher, and they range from 1 million all the way to 3 million. For inpatient, for outpatient is between 150 and 450. It becomes unlimited, both inpatient and outpatient becomes an unlimited if you access cover from the public facilities, government facilities, then the limits do not apply. But the minute you go to a private health facility, then your benefit starts deducting. Dental and optical is standard across. For dental is 45,000 and optical is 60,000. Maternity ranges from 120 to 300,000. Funeral cover is standard. It's 300,000 for everyone if the principal member passes on. Then evacuation is 4 per family per annum. Evacuation is through fixed wing. Then we have the international treatment that is besides the inpatient cover. This is when a teacher or a member accesses benefits abroad, mostly in India, and that benefit is at 2 million. There are some unique scheme features for this scheme, and most of them I will highlight. We have something called post-hospitalization. Normally, when you get admitted to a hospital and then you're discharged, there are cases whereby when you go back to the hospital, you'll utilize your outpatient cover. But for this scheme, for 5 weeks, or rather 35 days, you have post-hospitalization cover that comes out from your inpatient benefit, because outpatient benefit is usually very minimal and it gets exhausted quickly. Which is similar to the second one. There is a benefit called laser surgery, which is within inpatient. I think I've spoken about overseas. I mentioned about the 2 million, and there is a 200,000 ticket. There is a scheme feature that is being rolled out, mainly on e-health and e-consultation. This is still work in progress, but it's a scheme feature within this cover. There is the annual health checkup, whereby women teachers can access the pap smear, and the male teachers can access the PSA. Then it also covers prosthetic devices. It also covers, there is hospital bed entitlement, there is immunization for children, there is family planning. Not a lot of medical covers or health insurance covers, they don't cover fertility. Teachers' medical scheme is among the very few medical schemes in the country that offers this particular benefit. Then diagnostic equipment, as and when they are required, and the travel vaccines. There is the alternative treatment, such as acupuncture, drug and substance abuse, including alcoholism. Again, this is also a very unique feature. Most of the time, other health insurance covers will not cover things like alcoholism, but teachers' medical scheme gives that. The domestic violence. In fact, these are just some of the additions. Previously, the teachers' medical scheme has been there for a period of 9 years, and these are some of the enhancements. Domestic violence previously was not covered. Right now, it's covered. There's the dental crowns. I had spoken about the air evacuation. Then there is a program that is called CDM, or Chronic Disease Management. What we normally request our members to do is to register for CDM program, so that their details can be put on the system, and then getting the medication becomes easy. These are members who have chronic illnesses, and they require drugs month on month to maintain or to be able to continue living healthy. And there is a link there where people need to be able to enroll on this CDM program. The other benefit is on funeral cover. I mentioned this is a standard benefit across all job groups, and it's 300,000 payable when a teacher passes on. There are some requirements that the member needs to provide, and this requirement is, as you can see, we need the original copy of the burial permit, we need the national ID of the next of kin, we need to know the relationship of the person who's claiming. We need to know their mobile number because it's 300,000. So 100,000 is usually paid via M-Pesa and 200,000 is payable via bank. So we also need an ATM card or a statement of a bank to show that the account is active. And we also need a form needs to be filled and death certificate for the deceased member. So I think I've taken you through the benefits. So previously, there were a lot of exclusions within the cover, but when this particular contract started, the 3-year contract started, a lot of benefits were added, and almost everything is insured in this medical scheme, apart from a very few things, that is anything to do with cosmetic, anything that you self-prescribe yourself, anything experimental, cost already catered for by another insurance. For example, sometimes you're told to pay bed rebates because bed rebates are previously does not allow reimbursement, whereby you will go to a hospital and pay and then seek reimbursement. That is not allowable unless it was through an emergency and there was nothing that could be done. Then that emergency needs to be approved, and then the reimbursement can be done. And maternity for dependents. So the last slide, I believe, is on eligibility of members. So the scheme covers 5 dependents. That is the teacher. That is the teacher, 1 spouse, 1 legal spouse. So 1 legal spouse. Is there an issue? Yes. Sorry? Mother. Okay, so let's finish. So the legal spouse must be above 18 years, and what you need to provide for a spouse is their national ID and a proof of marriage. A proof of marriage can either be a marriage certificate, a Kathy certificate, or an affidavit. Affidavit needs to be drawn from a lawyer called a commissioner of oaths or a magistrate. So for children between 0 to 18 years, you need to provide a birth certificate or a birth notification or an adoption document. Birth notification is only between 0 to 6 months. After 6 months, you're required to provide a birth certificate. Then there are those children who are still in school and still dependent on their parents. So these children, we require to provide a proof of schooling. And a proof of schooling can either be a school ID or a letter from the school. And there is no age limit for children with disability. So if a child has a disability, you just need to provide their birth certificate and a disability card from APDK, and they will enjoy cover until the teacher retires. So registration is very simple, is through the phone. So through USSD code, you just dial *865# and follow the prompts. It will guide you on how to register your dependents. So mode of access, there are two. There is the direct access and there is the referral access. Direct access is where you can just walk in and walk out. There are those facilities that you can be able to just walk in and walk out. Then there is the referral facilities. I think in a different slide, you saw where I said that MAKL, they are responsible to ensure that the referral from one hospital to the other one works. So because the scheme allows those two access, direct and referral access, and the hospitals are categorized like that. There are hospitals that you cannot just walk in; they are purely for specialized services. An example is the Karen Hospital, which normally deals with heart conditions. So the referral protocol is you can see there. So the service provider, you will visit a service provider, then they will attend to the member or to the teacher, handle that particular case, then they will request for a referral. It's usually done on the system. They will request for that referral. MAKL will approve that referral, and then you will be given, there is an SMS. Okay, so this is the other option. I think there is a term that mainly probably people normally don't really manages the cost is through negotiations with the service providers, through the negotiation with the people who offer services. So they will provide those services through a negotiated way of managing the cost. So we agree that these particular services you're going to provide to our members at this cost. So the scheme, like the magnitude of the teachers' medical scheme, which is very huge scheme that is covering over 1 million lives. There was initially there was this particular requirement whereby, and it was through still the negotiated model with the service provider, but it was being misused because the teachers could not access cover within 7 days. When you go to the hospital, you are told 7 days are not over and you could not access cover. Before, they were saying you have to wait until 7 days are over for you to be able to access cover. But that was removed, and nowadays you can go to the hospitals even if 7 days have not lapsed. But basically what providers encourage is that you provide good services, provide proper medication, so that within 7 days, then the teacher does not require to go back to the hospital. I think we don't like going to the hospitals. The hospital is not a place that all the time we like to attend. So, but the rule was removed. Then there is the issue of pre-authorization. Pre-authorization is also an administrative process that is used not just for the teacher's medical scheme, but across all the insurance cover. And again, it's an issue to manage the cost, because uses this way to actually be able to manage the benefits that have been given by your employer, to ensure that the benefits are properly utilized and they are not misused. And normally, this pre-authorization will not be asked for everyone, like for everything. Like for outpatient cases, it's just a walk-in, walk-out cases. But for specialized cases, for inpatient cases, those cases will always be pre-authorized. And sometimes a pre-authorization may be rejected or may be declined, and it may be declined either because the cover has been exhausted, the benefit you are accessing is an exclusion, or basically the hospital has not provided enough documents or enough details as to why that particular procedure or that particular pre-authorization is required. And channels, we have 24, the number we have 28, and we have so wherever you are, if you get stuck, then you just dial that USSD code *202*06#, and then you record whatever issue that you're facing, and our team will be able to get that, and you will be able to be assisted. There is a social media platforms, that is a Twitter, Facebook, and Telegram, that you can always interact with us, and we'll be able to assist you. I think that marks
Jackie, I'd like to ask the executive to come and just have a photo with Jackie, kindly.
It's a real issue for our members, and the coordinators are here today. They are always calling me and telling me ABCD. So before we take the photo, my sister, can you just give my coordinators a few minutes to ask you a few questions so that you can clarify?
Introduce yourself and then you ask the question. Josephine.
I'm Josephine Wahome, Nairobi chapter. I have two concerns about the pre-authorization. Last year, I was admitted thrice at the Nairobi West, and it took
Make it short.
Thank you. I'm Binti Amisi from Kwale. My sister, teachers are suffering. I'm a victim of that. Last week I was at Diani Hospital and I was given some medication, but even a medication of 180, AN cannot prove for that. I had to buy for myself. So if we agree to give you our money, why don't you give us good service?
Thanks. We give you a few moments to answer those.
Okay. I want to, on behalf of Minette, to really say that we are sorry for the suffering that is being caused to these providers. But I think you have seen on my presentation that our partners, MAKL, that we work with, they're the ones who are in charge of pre-authorization and approvals. We take this feedback, and every now and then we hold meetings with them to actually provide this feedback and to request that the services are provided as they should. So we work with them on a day-to-day basis. Every time your pre-authorization has been rejected, you will call Minette and we will work with our partners to ensure that the same is provided. We take this information with a lot of concern, and knowing that every single day we keep on improving and talking to them to ensure that these declines are not done and these medications are provided as they're supposed to be provided. So I've taken with me that a lot of CDM patients are suffering because these medications are not available. Bliss is not giving the medication that they are meant to provide. So these are the things that from this forum I'm going to take back to my office so that we can have a discussion, a sit down with and we sit down and discuss and agree how best can we improve on this. Like for example, I've mentioned about the 7-day treatment, 7-day rule. Previously, it was really a challenge and teachers really complained, and we managed to remove that. So right now, the complaint here I'm getting is about CDM medication and pre-authorization. And I want to say this, that we are going to work on it and to ensure that the same is improved to your satisfaction. We will not rest, and we will continue to work together hand in hand, getting your feedback and working with our partners to ensure that you get the services that you require.
Okay, thanks. So it's like it's okay. So this is what I'm asking. So please don't repeat any question that has been asked. Sawa. 30 seconds.
Si nimepewa.
Let's give
Let me
Amani
proceed.
chance first.
First,
Okay.
I want to thank you, Jackie. I'm Ruth Nditu. I always call you, and you always respond. Thank you for that. But we have a problem. People in Makueni are calling the Bliss a death kiosk.
So for now, let's address that question. Order. Hello. Kindly let's calm down. Sawa. Kindly.
Hello. Yes. We are dignified people. Yes. We are orderly people. Yes. We have questions. Yes. We are going to ask the questions. It's a half-day session. We have not had our AGM. We are not limiting the questions that you should ask. I'm going to say, maybe we allow about 3 others, and the digital way is there. This forum, as we began yesterday, was for digital transformation. So accept that the questions that will be asked digitally will also be answered. And let's not make noise. You know, people sitting there and they have seen dignified people in purple and smart. Let's be orderly. Kabogo, my brother, I will give you this permission, allow me, so that he doesn't make noise, because he's a noise maker. Come. Now, and please, when you're asking your question, don't make it a storybook. Ask the question precisely and shortly.
Thank you. Ladies and gentlemen, I'm John Kibogo. I'm a chapter leader in Nairobi. I teach at Moi Forces Academy. Madam, we know you are innocent. Number one, wewe ni very innocent, you are only a messenger. Na kutoka kule nimetoka mimi niliambiwa mjumbe hawa kuna maswali huyu hataweza kujibu. Number one, nyinyi walimu mnajua. Unless unajua mtu